Okay, class, where we are is to talk about the blood supply to the kidney. The blood supply to the kidney. That's where we are. We'll start again here. Okay, we're starting with this list. The coming off the aorta is the renal artery. Goes to the right kidney and the left kidney and the right kidney. Coming off the aorta. Okay, we come back. So now, and it's an end artery, remember, one artery going there. That's why if it's squeezed down, you could get hypertension. You check, go back and study your earlier stuff in cardiovascular on blood pressure. So here we are. The artery comes in, and then it breaks into what we call segmental arteries, because the kidney kind of is made into segments a little bit. So it branches, it comes, and then branches into segmental. That's one segmental. Let's say that's another. The segmental arteries then branch and go straight down in between the pyramids, which are called the renal columns. So it goes straight down here, renal columns in between the pyramids. And actually, if we take this whole thing, we talked about in between the lobes, because a lobe would be the pyramid plus that associated area of the cortex. All right, let's go. So in that case, if it's going between the lobes, that's why you call it the interlobar artery, between the lobes. Then the artery comes out, and every time it's getting smaller and smaller, diameter smaller and smaller, as it comes here between the junction between the cortex and the medulla, so right about there, cortex and medulla, that artery is going to splay out. You say, what do you mean by that? Here comes that artery here. That's the interlobar, and it's going to splay out like this. And this one would do the same thing. It's kind of like it's forming an arc. It's kind of like it's forming an arc. So that's why they call that the arcuate arteries. The arcuate. Now we're at the junction between the medulla and the cortex. All right. Then what's going to happen is, now coming off of there, let's go see if this picture will do it for me. Coming off of there, the artery is then going to send some branches off that are called the cortical radiate, or some will call it the interlobular. Some will say that the cortex is broken up into lobules. Now let me tell you, L-E at the end of a clinical word means little. So little lobes. So you may see in some texts cortical radiate, or you may see the word interlobular as that, which I have up here. See, I have arcuate then interlobular. So I'm using that here, and here I'm using cortical radiate. You say, why do they call it the cortical radiate? Because look at it like this. It's like it's radiating out in the cortex. It's like it's radiating out like a sunburst. Like a sunburst in the cortex. All right. So that's the interlobular. All right. Now, blood vessel chapter. Now what we've done, we've attained a diameter of 0.01 micron. So we're now in the diameter of an arteriole. Remember the chapter on blood vessels? So this is what we're doing now. We now are going to send, let me come here. We're now going to send an arteriole to a capillary bundle. So we're going to call this the afferent arteriole. The afferent arteriole. Because we're going to something. What we're going to is a ball of capillaries called the glomerulus, the glomerulus. See, so in other words, we're going to this ball of capillaries, okay? And here's the glomerulus right there, this ball of capillaries. See, this is cutting open one of these and looking inside, okay? So we went from an afferent arteriole to a ball of capillaries, which is the usual, arteriole to capillary, okay? Arteriole to capillary. All right, that's the usual. Now I'm going to come to this picture and show what I'm saying. So right here, we're coming with what we call the afferent arteriole. The afferent arteriole, which is this right here. So we're coming with the, and we're going to this ball of capillaries called the glomerulus. Now, anatomy was not made for us to name. Anatomy, the Creator made anatomy for function. You hear what I just said? For function, not for just human naming. What do I mean by this? Normally, when you come from a capillary, where do you go into? A venule. Normally, when you come from a capillary, what do you go into? A venule. It's not going to happen. Why? Because of the function. So the usual and customary is not going to happen. It's going to an arteriole. Why? We'll see later. We'll see later when I explain the physiology. So I need a two arteriole thing. Now there are other things in the body, not just in the kidney, where I need something different. All right. So then coming back from the glomerulus, we have what we call the efferent arteriole. Coming back, we have the efferent arteriole. Then what are we going to do? Go back again to some capillaries. Go back again to some capillaries. Now these particular capillaries surround these tubes we'll be talking about. See, we still got to do the tubes to put it all together. These capillaries surround the tubes. So what do we call those? Peri-around tubular capillaries. But we have another set of capillaries like this. See, again, here's an efferent arteriole. In this case, the efferent arteriole comes and goes into another type of capillary that are called straight capillaries, straight vessels, known as the vasa recta. So there are two possibilities. Either go peritubular or vasa recta. When do you do what? Again, that's a subject for physiology. So right now, just know this, we just setting up the anatomy. Hey, we just setting up the anatomy. All right, now we're going back to the venous side. And let me tell you, to make it simple, just like we came in, we're going to follow the same pathway out. So what does that mean? We're going to do cortical radiate venue. Then we're going to do arcuate. Then from arcuate, let me come down. So cortical radiate, arcuate. Then we're going to come between the lobes. Come down. Let me get you another picture. We're going to come between the lobes and do the interlobar veins. Interlobar veins. Do this picture. The interlobar veins. And then after that, we're going to do the renal veins. See, there's no segmental. And then we're to the inferior vena cava. So what we did was go through here. Now, where the issue comes is in these things here. Afferent arteriole, glomerulus, efferent, and this here. See, that's where the fizz is going to come. This is pretty straightforward. You're just coming in and coming out. You hear what I just said? You're just coming in and coming out. So the real physiologic questions are going to come in this right here as we approach it. All right? But again, right now, I just want to concentrate really on the anatomy in this particular video here. So again, that's this here, which you saw, and that's this here. This is what we call a renal arteriogram. Just like we could do a heart arteriogram, we can do a renal arteriogram and inject dye. And this would show those blood vessels. We do that if you think you have, stenosis, which is tightening of some blood vessels, or clogging of some vessels, to see what it is. So this is called a renal arteriogram that you see. These are the kidneys, that's the blood vessels. Okay, let's go a little further here. Okay, so we said that each nephron has two capillary beds. Now, before we can do that, we have got to describe what the nephron is. All right, so our job now is to describe what a nephron is. Okay, and I'm going to do that in the next video. So we're going to do the nephron.